Good morning. I'm Pelto. Welcome to Podiatry Practice Mastery. I'm going to go over my $1,000,000 minute. This is where I try to help you get your practice to the $1,000,000 mark and beyond. So this day was a Thursday, and I'm going to kind of go through the patients. Now, in the morning we had a presentation from 8 to 9 by ModMed. We're thinking about switching soon from Athena to ModMed, and I'll be sharing with how that's going to go. But it was a good presentation. I think it'll save us quite a bit. And from ancillary, so that's why I started kind of a little bit later. So there were about, I think, 20 patients and maybe one add-on this day. So the goal here is to try to get to $200 per visit and about 20 patients a day. So the first patient was a patient that came in and had nail fungus, and we did Formula 7. That's the one I do topically. There's some others that are really good, and they got my kit, which would be the spray and then the UV light, and I give them instructions. They also came in for ultrasound for Achilles bilaterally, and then they're going to set up bilateral shock waves for 3 sessions. So that'll be the future visit. So that would probably be the MVP of the day, because they set up that bilateral shock wave. I do give them a discount if they do all 3. So they're going to pay between $6 and $7.50 for each side. So you double that. Next patient was a new patient that came in, got x-rays, they had neuropathy, and I learned something at the recent meeting, at the AAPPM meeting, which I thought was good, is to sometimes, like, he didn't know his A1C, so I actually looked in his chart, and I could access his notes from his diabetes center, and I could look at that. So by looking at another doctor's notes, that is a way of kind of upping it, along with other things that I did. He had neuropathy. And he had an ingrown toenail, so we did IND, and I'm going to see him back in 3 months, and during this 3 months, we're going to check on his insurance because he does have neuropathy, and we're going to check on Qtenza coverage. Qtenza has been doing well for us. It doesn't really take that much work, and it reimburses quite well, and we're having good success. The patients say that it's kind of helping them out. Next patient was another patient that came in for a toe, and he kind of fell down and he got up, and as he was getting up, he was neuropathic, so he fractured his toe, so I had a fracture code. I spent a lot of time with him, and we're going to do a 4-week follow-up. I also punctured, he had a fracture blister, so that blister was quite big, so I punctured it, and so there is a code for like a bulla, or like a blister or hematoma that can be popped, and there's a procedure code for that, so I did that. And then he also had the neuropathy, so I'm going to check on him for Qtenza as well. Another new patient that came in for basically nails and a porokeratoma, so I did lesion destruction. I'm not going to see him back because he'll come back as needed for that. I did do a floating cutout in his shoe, so that's where under the area, it's usually the 5th med head where I'm doing these. I cut out the 5th med head and flip it back in the liner and then tape it, and then I do that in the method so that they can put it back if they don't like it, and then if that works and they like it a lot, we can do an orthotic if the thing comes back. Another shockwave patient for 2nd med head. There was a patient that came in for what I call a Lamisil booster appointment, so I do my first visit for 3 months, Lamisil, and then they come back for a booster. I do a kind of a lesser dose for 6 months and then back to the normal dose. If you have any questions, you guys can just email me on those things. Another new patient with IND, another patient that came in, they had a hard time. I gave them bilateral velocities because they had some rear foot involvement. So velocity is kind of like a non-custom AFO. Couldn't put the thing on. Frankly, sometimes they're hard to do. So then transitioned that patient to an actual custom orthotic. So they got a custom orthotic at this time. The next patient was the Lamisil booster, EPAT number 2. And then it was a nail patient that came in. This patient came in for like an ingrown toenail, kind of similar thing with PVD, so I had them get a vascular referral because I don't think it was really bad ingrown toenail. And then he also has a cyst that he wants removed. I'm going to remove a different day in the office, but I'm going to first get the PVD workup. I saw a fracture follow-up, so I usually see when I do fracture codes, I do 1 follow-up, so this is the fracture follow-up. They're doing fine. This is a fibula fracture. Then I saw a patient, I have a Cutera laser, and I have a certain scar setting that I use for scars, and so I don't do a ton of this, but she had a previous incision on the plantar. Actually, she had a brachii met surgery by another doctor, and the toe was slightly plantar flexed after. X-rays looked fine. I think, and they even pinned it, but I think the issue was just the scarring because it wasn't moving for such a long time. So I find this laser sometimes works. So I had them do this laser. They're going to do 3 sessions. So I use lesion destruction because it's the scar, and I heat it up, and then it helps the range of motion, and that usually helps it and helps kind of realign the scar tissue in the proper direction. I'm also giving her some Mederma and some other things that she can use topically. It's kind of a weird one. She'll be back in 3 weeks for another laser. Another new patient just for a routine, but they really didn't want foot care. I almost like talked them out of foot care, so they're not going to come back unless they need me. There's also a patient that came in. She had pain to the first metcuneiform joint. I did an ultrasound, and if I found that, and I did a little cortisone in that joint region there. Another patient that came back, kind of a orthotic redo. Her orthotics were really too high in the arch, and I tried to heat them up with my heat gun to drop it down, but it really didn't work, so I had to have them, they're just going to send a new pair. I just told them to bring it down by a few millimeters. Uh, so, like, and then also there was a patient that came in for a toe contusion. And once again, I did an IND of the seroma, kind of a similar code. No follow-up for that unless there's any issues. I had a patient with Swift. This is Swift number 3 on her. She has a really big mosaic on the bottom of the foot and the forefoot, and then she has 2 other ones. This is number 3. She's able to tolerate it well. Just because I've been there so long, she's a little concerned. What I tend to do for Swift is I do 4 treatments a month apart, and then I do a 3-month follow-up. So then if that doesn't work, then I kind of start adding catheter and other stuff with it. I have another patient that as well I saw. This is a patient that had tried a number of things for her toenail. She's tried terbinafine, she's tried fluconazole, and then it's still not working. I kind of recommended she evulse the nail and try and start over, but she wanted another medication. So either I do itraconazole or I do Sporanox. So I don't do those a ton, but that's kind of where I'm going to next. Then the second to last patient was a plantar fascia patient that wasn't getting better. This was a struggle. She's a nurse, but on her ultrasound, her fascia is very thick. There's a lot of effusion in there compared to the other side. And so I'm going to do shockwave again. I did 1, 2, and 3 with the radial, and then 4, 5, and 6 I'm going to do primarily just the focus. So I have it in my other office. I'm going to do it there. It's pretty effective, but I'm a little concerned because she's a nurse, and if she doesn't get better. And then finally, there was a patient that came in that did well with injection to the plantar fascia before, and I did another fascial injection. That was number 2. I said probably the next thing would be the shockwave if things continue to bother them. So if you guys found this helpful, I have a lot more resources on the website, podiatrypracticemastery.com. There's like a $1 million kind of blueprint that might help you. Kind of the focus I have in this is just kind of showing you what I do every day, how to reduce the low-level visits and not have them come back and increase the high-level visits. So I found it beneficial. Have a good day.